I have got one tip for you today that will make a massive difference in the amount of pain that you experience and in your pain experience going forward in your life. So this video is for somebody, obviously, if you found my channel, then you are probably somebody that's experiencing pain like I have in the past, or you may know a family member or a friend that you're trying to help with their pain experience. Hi guys, my name is Dr. Rachel Gilmore and I am a chiropractor. And before you tune me out, I'm not your average chiropractor. I'm not your neighborhood chiropractor, nor am I somebody that just cracks people and sends them out the door. I am somebody that tries to strive to help my patients and who does and has successfully helped hundreds of people, hopefully thousands and hundreds of thousands in the next 5 to 10 years, get rid of their pain or manage their pain better for the long term. I help people from firefighters to your average mom and dad to people who are a little bit older or people who have experienced acute injuries like athletes and other people like that, manage their pain better and get rid of their pain. Unlike other chiropractors in my office, I actually graduate people from a plan of care, and typically they don't need me, or they just come in because they like what I do and they want to continue getting better for the long term. So, what is the one big tip that I have to share with you today? Like I've talked about on my channel before, and actually, before I get into the big tip, I want to ask you a question. Are you somebody who is anxious? Have you experienced depression? Have you experienced more stress or more worry in your life? And if so, like myself, I have experienced these things in my life as well. And one thing that I've figured out is the next question I'm going to ask you today. So if you're at home watching this, or if you're in the car, or if you're, on your phone watching this, have you noticed that in times of worry or stress, or times that, you may have more things to do at home, or more family things, or financial obligations, or things like that, have you noticed that your pain experience actually gets worse when these times happen? I don't know about you, but I did. Like you probably may be thinking, that's interesting. Maybe I have experienced this in the past. In the past, I correlated my anxiety and my stress levels and my what I call management of my mental mess to my pain response. When I have more anxiety and when I'm more stressed and am, experiencing this more, I seem to have more pain. And pain just seems to come out of nowhere sometimes. Either you wake up with it, or, during the day, you get flashes of pain that are a little bit worse. In my case, I actually used to have sharp stabbing pain on this left-hand side of my scoliosis. And if you don't know about my story, then go back and watch the previous YouTube videos. I'll put a picture of my back right here for you so that you can see. I used to have stabbing pain on the side of my back. And honestly, at one point in time, before I knew anything about anatomy or anything, I thought that my internal organs were being stabbed by my rib cage, and I was worried that something was wrong. And honestly, if you're out there and you've experienced things like panic attacks or pain, and you've presented to either urgent care or ERs before wondering about your pain, let me just tell you that this is completely normal, and that I have people in my office from time to time that are experiencing these things that, think they're having a heart attack or think that a stroke is coming on. And, by all means, we do everything that we need to make sure that that's not the case for the person. And if it is, we get them out to the local, emergency services as fast as possible. Fortunately, I haven't had to experience that yet or help anybody with that at this point, getting them to the ER. But we have patients sometimes that come in and that, experience this and have to, go for other, procedural things like steroids or medication to kind of help with their experience. But that's beside the point today. So if you're out there and you've experienced this before, I want you to start to pay attention, like I did, to your pain and when it comes on. One thing that I ask my patients constantly is this same question. When you're at home and when you're experiencing more pain, I want you to pay attention to what's going through your mind. I want you to pay attention to what's happening at home. Do you experience the pain when you're doing a certain activity? Do you experience the pain when you're having more stress? Do you find that when you have more episodes of things like anxiety, depression, and other things, that you experience more pain? Because if the answer is yes, then I have an amazing tip for you. Because paying attention to these things, and like I call it, body awareness and mental awareness, can actually help you reduce the occurrence of pain. Now, what's really cool, and kind of what prompted this video today, is that I found some research to finally confirm my theory that, and this has been around for 27 years. I'm going to post the articles over here so that you can see a few of them that I found. And if you want the links, I'll attach those in the video show notes so you can check those out. But there's research, and I'm going to keep researching this because I am a researcher. I still work with my university on the side and plan to do something with this because I think this is really cool. But this research has been around for a long time. And one cool thing about this is that what the researchers have found is that personality impacts your pain response. So paying attention to your tendencies and what the researchers call neurotic behavior. Now, what is neuroticism? So let's just define that for now. We're not going to say that it's a negative term or anything because it does sound kind of like a negative term, but that just means that you're more prone to things like anxiety, depression, more worry, more stress possibly in your life, and other things like that. So that's a short definition of what neuroticism actually is. And what they found was that people that tend towards this behavior of neuroticism actually have increased levels of pain and a worsened pain experience, which is what I tell people and what I found in person and in what I learned in school and what they taught us was that stress increases your pain response. So by paying attention to this and actually paying attention to what's going on in your mind and having a sense of what I like to call control over this. Now, this is a lot harder of a concept for people to actually manage sometimes. So having that awareness, first and foremost, is going to be one of the most important things that you can do to help yourself start to decrease that pain response. Now, how did I do this? I'm not going to go through all of the things because some of my videos already talk about this, but here's one more thing that you can do today that will actually start to help you desensitize that pain response. So when you're having these episodes of, anxiety or, more thoughts or more stress, what I want you to do is I want you to slow your mind down a bit, and I want you to not feel the emotions that are being provoked by the thoughts, because you are not your thoughts and emotions. That was a huge tip for me as well. And I want you to let them pass through your mind. A counselor once told me when I was in a session and I was deep in my emotion and we were going through an exercise, she said, I want you to imagine that your thoughts are like leaves falling off a tree. And you're sitting by this creek, this river that's flowing. And those leaves, thoughts, are floating down towards the river. And they're landing in the water. And the river is going. And the thoughts and the leaves are floating past you. You don't attach any feeling to this. You just observe them. It's kind of like in meditation, and I used to say that I was the worst meditator ever, but now I've gotten to the point where I can drop into a flow state, and I teach people how to do that on a daily basis. Shameless plug for that. If you're looking for somebody and you're watching this video and you've kind of resonated with what I'm saying so far, and you would like to work with somebody that can be your guide and that can give you a solution for this, please reach out to me. I'll put my information in the show notes for you. And definitely like and subscribe if you're not already subscribed to my channel for more content like this. But if we can become an observer of our thoughts, we can gain more awareness around it, and we can gain a sense of control over what we're thinking and what feelings that we attach to these thoughts. As somebody who had anxiety in the past, and you might be somebody like this, who you're just stuck in that endless cycle of anxiety, that endless loop of stress and depression and all of these thoughts and everything, and you just attach so much emotion to them and you feel them deeply. Believe me, I feel things deeply, if you can't already tell. My excitement, my stress, my, fear sometimes, and all of those things can become a part of us. I don't know if you've heard this expression before, but I tend to live by this now. Your personality creates your personal reality. And I heard that from Dr. Joe Dispenza, who we won't talk about him right now. He's done some great work and everything, and definitely influenced my train of thought with all of these things and the work that I do on a daily basis that I've continued to morph into my own method and system that I use for people, like I said, on a daily basis. But your personality influences these things. Obviously, this is what the researchers found in this literature that I'm telling you about, is that people who are more neurotic, people who are actually more introverted because they pay attention to things more inside their body typically. Extroverts tend to have less pain because they don't pay attention to it as much. We can dive into that just a little bit later, but super interesting. More neurotic tendencies, more introverted personalities tend to experience more pain. So developing this level of awareness and this level of control and sense of, I can manage this, or self-efficacy around your pain can actually help reduce your pain response over time. which is, if you can tell how excited I am about talking about this topic, something that I teach people on a daily basis and something that has made a massive difference in my life in managing my pain. Because when the pain does come on, I tended to notice that sometimes, even like yesterday, I can think of, I was experiencing more stress and I was more in my feelings and, just overthinking things too much that are happening in my life, which, by the way, you can't control a lot of what other people do. Actually, you can't control anything about what other people do, but you can control the thoughts and the feelings that you attach to your experience and to what's going on in your life, because the only thing that you can control is you, just like the only thing that I can control is me. So when I started to pay attention to these things more and I started to go, I'm having more pain right now. Okay, let's do a self-evaluation. What's going on in my body? Am I more heightened? Am I more tense up through here? Am I holding more tension? Even this came up in a visit, and actually has come up in multiple patient visits recently, where I've asked the person to pay attention to their sleep. When you start to go to sleep at night, if you wake up with, maybe numbness or tingling in the hands, or if you wake up, with more pain, or if you wake up, with more tension, which we're resting. We're in a position for a long period of time, sure, so that definitely can impact the way that you have pain. But what I've noticed is that over time, I realized that I was actually clenching muscles and tightening muscles instead of relaxing my body into my pillow and into my bed, which is kind of a crazy concept, because when you lay down at night, we're resting, right? When you lay down, on the couch or in your chair or whatnot, we're not supposed to be holding tension in our bodies, but for whatever reason, like some people experience, they hold tension in the jaw when they, get irritated, or they tend to clench at night, sometimes unconsciously. Our body can do this unconsciously without us being aware of it. And that's a protective mechanism that I'm going to go into sooner in the next videos about why this happens. Because sometimes if you're not paying attention to it, it can happen, and it can be a thing that can actually cause pain and cause irritation. And you wake up and you go, why am I having this pain? Why am I having this irritation? I didn't do anything last night but sleep. So it's a really interesting concept, because when I started to actually pay attention to what I was doing and I was clenching and not, relaxing into my bed, I started to change that. And now when I go to bed and I realize, I'm sitting there reading on my phone, and I have my phone in my hand and I'm on the pillow. And if I realize that I'm doing this and just holding the tension, I relax my body into my bed and into my pillow. And yes, mattress, pillows, and all of that kind of stuff can make a difference, or sleep posture and everything. But I find that if we truly get down to the root cause of what's going on in your body, and sometimes it is physical, sometimes it is. Pain is a very, very complex thing, and that's why it's so dependent on the person and on their experience and what's going on. But we're honing in right now on being able to be aware and control what you're doing to help manage your pain experience. So the literature, like I said, was super interesting on that. And one thing about that is that if we start to pay attention to our personality that creates your personal reality that can impact your pain experience, and we start to change these things and not worry as much, because I know that people out there, just like I did, I got labeled as somebody who had anxiety, and saved myself from a clinical diagnosis because I told my counselor, I was like, look, I know that I probably do have this and have developed this, but I'm not going to label myself as this, as somebody who has this, because labels have a massive impact on you. But just know that in your heart of hearts and in your soul, in your mind, whatever you want to say, with spirit, through God, whatever flavor you have, you can change this. If somebody who was experiencing panic attacks in school and had to physically leave the classroom when I was in chiropractic school because it got that bad at a certain point in time, can go from that to now somebody who helps people change their life with these things, then you can do it as well too. And you can do it through these simple things. So try the exercise. Try the tensioning exercise that I told you about when you go to bed at night, if you're somebody who wakes up with those things. If you're somebody who worries or has anxiety or depression, then let's try to analyze those thoughts a little bit. And I don't want you to overthink about these thoughts. I don't want you to attach feeling to them that we often do. I want you to start to pay attention and observe the thoughts coming in and out, and just let them be. Sometimes journaling for me helps and can be a good tip for people as well, that can actually make a massive difference in, the way that you feel. The one tip for that is that once you journal those feelings, leave them there. Don't overthink them. Don't bring them back into your reality throughout the day. Don't talk about them with other people unless you need to get that out. But after you do, feel it and then let it go, because that's going to be a major thing that can help you impact your pain experience. So I want to thank you for watching this video today. If you found this interesting, definitely comment below. If you found something useful, comment below, share it with a friend. Make sure to like this video and subscribe to this channel for more information and for more tips on how you can better deal with your pain and then live a better life because of the tools and coping mechanisms that you have learned. I hope you have a wonderful day, and I wish all of you to stay so very blessed this weekend. We'll talk soon.